my collection really started just like Topsy. And what I found was that when I joined family planning, my predecessor, Dr. Gordon McDougall, had already kept some items, which I found quite interesting, and I kept on doing this. But mainly it was a teaching resource because I was involved in teaching family planning staff, medical students, nurses, and it helped to actually have a collection of devices that you could show them. My collection, I think, is, looking back on it, of course I didn't realise that at the time, was actually recording a lot of the changes in contraception and its use. And I would say that the theme running through it is still our search for better, more user-friendly, safer methods of contraception, and that will continue. In the 1980s, one of the biggest events that changed contraception was HIV and AIDS, and particularly with the promotion of condoms. In the past, condoms had not been very reliable, there hadn't been a great range, they hadn't been a popular method, and that had to change with HIV/AIDS. And it did so in New Zealand, largely because of the campaigning work by the AIDS Foundation. Condoms had to be made more user-friendly. They had to be more accessible. And one of the things that, for instance, happened was removing them from the chemist's shops, where people sometimes felt embarrassed asking for condoms, and putting them on the supermarket shelves. That happened in 1985. And then we began to be a little bit more adventurous in promoting condoms. For instance, in 1986, there was the first television advertisement for safer sex and condoms. Admittedly, we didn't see a condom, we only saw a parachute, but that was an advance. In the development of new contraceptive methods, I think that mistakes were sometimes made, and this was largely because of big pharmaceutical companies interested in making profits, not taking due regard to women's health. I think in the development of new products of contraception, the consumer is now taken very much more seriously. One of the most satisfying things in my family planning work was really helping people to find a method that suited them. And sometimes that wasn't easy. Many people had side effects on the pill. Many people couldn't use an IUD. Many people found diaphragms uncomfortable. And just finding something that really suited a particular person was often challenging. But when you did find something that people were suited to, that to me was just a joy.